name is Dr. Casino, and I'd like to talk to you today about gum recession and what causes gum recession. Gum recession is when the gums pull away from the teeth and expose the roots of the teeth. So it involves loss of gum tissue, and the gum tissue is a covering for the jawbone underneath, so as the gums recede, also there's been some bone loss. So what's the problem with gum recession? Obviously, if it's in the front, around your front teeth, it may not look nice to have your gums receded. Sometimes the areas that have recession can be more sensitive to colds, primarily colds, but sometimes hots too, so they can be more sensitive. Receded areas, if the gums recede enough and there's bone loss, that could ultimately cause the tooth to be unstable and become loose. Another factor also, another problem unfortunately with the gums receding is that you can get cavities. The roots exposed don't have the hard enamel and can be more prone to cavities. So, what are the factors that cause the gum to recede? First and foremost, it often starts off with the anatomy of your mouth. Some people around their teeth have thick bone, thick gum tissue. That's not going to recede as easily as somebody who has thin jawbone around their teeth and thin gum tissue. Sometimes a pull in the gum tissue in an area can cause the gums to recede if you have a little lip pull. So the anatomy of your mouth certainly plays a role. Then if you're somebody who's susceptible to receding gums, one of the factors is plaque and bacteria. So if you get plaque and bacteria, plaque which contains bacteria sitting on your teeth, it can irritate the gums, cause inflammation, and as part of the inflammatory reaction that occurs, you can end up losing gum tissue and bone around your teeth. So some people who have receding have plaque in their mouths. On the other hand, interestingly, some people who have receding gums have very clean mouths. So what's causing their gums to recede? Often it's over-aggressive brushing. So people who brush aggressively multiple times a day tend to have more receding than those that don't. You want to use a soft toothbrush, and you want to brush properly. So the American Dental Association website, ada.org, has Mouth Healthy, and they have a video on there that kind of shows you how to angle the toothbrush at about a 45-degree angle into the gum tissue and just gently kind of vibrate the toothbrush back and forth. That's with a manual toothbrush. If you use an electric toothbrush, electric toothbrushes do work nicely, but you don't want to scrub with them. And so again, you want to use the toothbrush properly. With an electric toothbrush, you want to kind of walk it around slowly at the gum line. You do not want to be scrubbing with it because that can be too abrasive to the gum tissue and to the teeth. Malaligned teeth can also play a role in gum recession. If a tooth is a little more forward, it can be out of the jawbone and can have some receding. So if your teeth are malpositioned, some of them can recede. If a tooth is hitting prematurely, so if you're banging on a tooth and hitting hard on it and it's moving as you bite, that also can make that tooth more likely to have gum recession and indeed some tooth mobility to it. Ultimately, another thing that may play a role with receding gums is clenching and grinding. This might play a role, but stress forces on your teeth from clenching or grinding may exacerbate receding gums. As you can imagine, if the gums are likely to recede and now you're stressing them by clenching or grinding, that certainly can play a role in receding. There are 2 times a day when you can clench or grind your teeth. Nighttime, obviously, where you might be doing it while you're sleeping. If you're doing it at night, signs and symptoms may be a sore jaw in the morning headaches. You might notice your teeth kind of clamp together when you fall asleep. If you do it at night, you could think about getting a night guard, and that would help alleviate those stresses. If you're doing it during the day, sometimes people don't realize that they're clenching their teeth during the day. So by day, our teeth should be not touching each other. So our lips should be together, but our teeth should be apart. So those are really the main factors. Keeping your teeth clean, but not being overly aggressive in terms of keeping your teeth clean, and make sure that there are no additional stress forces on your teeth. Your dentist can help you determine whether or not they think you're clenching or grinding also. We do here at Naperville Perio, we treat gum recession, so you can feel free to visit our website to learn more about receding gums and the various treatment options.